Hey, what's up, y'all? This is Dr. Italo Brown, emergency physician, and this is Med vs. Movie. Now, last year, I remember telling y'all, I wasn't bluffing. I said, I'm gonna start breaking down these movies the same way I have on other platforms, but I'm gonna be a little bit more specific with how I break it down, and I know that y'all were interested, so I got you, all right? Now, the first movie that I plan to break down, ironically, is called Ambulance. I know it sounds pretty straightforward. It's like, yo, you're an ER doctor. Of course you break down a movie called Ambulance. But seriously, Michael Bay, dope with the visuals. So I automatically was drawn to watching the movie. But I knew it was gonna be something a little special. And I mean like special in the sense of like, it's gonna have over the top scenes. And there's literally tons of medical things for me to discuss in the movie. Obviously, they're in an ambulance car chase for 2 hours. I'm not gonna spoil the entire movie right off the bat, but I want you to realize that this probably would never happen in real life. However, some of the things that they discuss are clinically relevant, and I wanna break it down for you, all right? Let's get it going. We got to acknowledge our first responders while we do this. First off, like, y'all rock, and it is incredibly difficult to do any element of a resuscitation in a moving vehicle. Let's get that out the way. You know, we do ride-alongs throughout our residency, throughout our training, and one thing that I've realized is the stuff that we see when it comes into the emergency department is literally a byproduct of how well the work goes before they come. So our pre-hospital scene, you know, we gotta show love to the family that does this because it is difficult as hell to administer medications, to do any intervention en route while you're in a moving ass vehicle. Like, that shit is hard as hell.
Have 7 minutes, okay? Because you're driving
that's
this
real.
goddamn granny. Zach, I'm gonna be helping you, okay?
So, police officer shot. I've seen this happen before.
God, he's losing so much blood.
The funny part is when folks tell me that, like, oh, you've seen everything before. I'm like, nah, I mean, it's an emergency department. What you mean? Like, of course I've seen this before. I trained in the Bronx, New York, and it was a bank robbery, and somebody brought their partner in, and he was shot. So I've seen this happen before.
God, call trauma. Tell them to activate the team. We're gonna need lots of blood. He's hypotensive and tachycardic. We need to move fast, okay? Where's this blood coming from?
All right. Whew. So this part of the scene I actually identify with. She calls out essential vitals. The problem is, who the hell is she calling them out to? It's just her in the car. So she said he's hypertensive and tachycardic. All right, we get that. So you're using the terms to mean that this person is low on their blood pressure, hypotensive, tachycardic, their heart rate is elevated. So again, accurate. The part that I am most interested in is she says, where is this blood coming from? Now, anytime I have somebody that comes in, they're hypotense, I'm like, yo, where's the bleed? Is it in the belly? Is it something that's extravasating? Is it in the pelvis? Like, where is the bleeding coming from? Or rather, why are they so, hypotense? Why is their blood pressure low? So this is a good, accurate scene so far.
Damn, get out now.
So now I see who she's calling out.
Fucking gun pointed at me right now.
The dude that's in the, all right, so he's driving. But my point is he's driving. So why does he care that he's hypotensive and tachycardic?
You don't have a choice, let's go. Back up.
What do you want?
Just gonna borrow it. All right, come on.
Did you shoot him already?
No, I did not do it for you, Camille. Except the life you saved today might be your own. Do your job, all right?
It's Cam. My name's Cam.
She got hella blood on
no
her
way.
face, yo.
My name's Daniel, but I prefer Danny. I don't give a fuck.
I also
Cam,
realize
okay?
that if she has this much blood near her mouth and her head, why the hell is she touching the patient again? Like, there's nothing sterile about this. All right, now with the movie magic, these fools are zipping in and out of traffic. I ain't got time for this. Get me to the patient. All right, y'all. There is a scene about halfway through in this movie that is probably the most single hilarious scene that I've watched from a medical angle in a long time. I mean, God, dog, Michael, you figured it out, brother. So I'm gonna go ahead and let this thing play.
What are you talking about? You're not a surgeon. You can't do that.
You're an EMT.
Yeah, I fucking know that, Colin, but I have
One time for the EMTs. she said, you can't do that. You're a surgeon. Said, man, yeah, I'm an EMT. I like it. Swag.
What situation?
I'm a hostage.
All right.
Oh shit.
So
That
you
thing in
got
LA.
the energy,
You're in
huh?
the ambulance?
Colin.
Yeah? Who's this?
Yeah, I'm the guy who's gonna kill her if you don't help us.
Okay, no. All right.
Tell me what you see.
His vitals are dropping fast. He's losing blood. I'm gonna
Call some trauma guys. Hang on.
Cool.
What's up, Colin?
All right, so accurate. I like this part of the movie because this guy apparently is not a trauma surgeon. And I think that that's something that we confuse in our movies. It's like we assume that just because you're a doctor, you can do everything. That's not the truth at all. And so the right thing to do, what she did in this movie, is she called him, Buddy goes, yo, I got some trauma guys I can give a call. And so those dudes are the ones that are going to give her the step-by-step on how to get this problem fixed, whatever the hell it is. Unfortunately, the dude probably won't make it because he's bleeding, man. This is bad.
What's up, Colin? Farsi! Oh!
You gotta pair my phone to the screen. He needs to see the surgery.
Dr. Resnick and Dr. Farsi, we're trauma surgeons.
Wait a minute. Also true to the absolute core, the trauma guys, when they're not working, they are on the golf course. That's facts.
What do you got?
I love it. What do you
Surgeons
got?
are walking her through an
exactly.
operation to remove the bullet.
Come again?
RHD are on with her. The doctor's on with her right now.
Wow.
You hear what's going on right now?
Cam, what's the vital sign? Blood pressure, pulse.
It's not good. I'm sending through.
Vitals are crashing. Wait, start moving faster.
All right. Also accurate. The cool part here is they're acknowledging that this is an emergent issue. Like, ask for clear vital signs, and this is the indication that they have to do intervention. Now, in the emergency department, when we call out things like this, the first thing we're looking for is, all right, there's blood, the person's hypotensive and tachycardic. Are they stable? Can we stabilize them? Here, do they need to go to the OR quickly for exploratory laparotomy or something like that? I think that this is pretty accurate so far, except for the fact that they in the damn back of an ambulance.
There's internal bleeding.
All right, abdominal area swollen, internal bleeding.
Hey,
Not a real
do you have
term.
EMT experience?
We gonna keep it going. That's what I'll say.
I need you to open him up. Open the skin.
Wait, so she does have a scalpel. The entire time she has a scalpel. So she pokes
Okay,
a hole in
cutting.
the skin,
Cutting skin.
and then instead of using a scalpel, proceeds to use the trauma shears to divide the portion of his skin. I guess it's faster. I don't know. I'm not feeling that part.
Slow down. You cannot do this at 60 miles an hour.
Just pull it like a rubber band. We have 4 minutes to 4 minutes.
And pull. Pull.
Also accurate, they're using their hands to create spreaders. In the OR, there's usually a tool for this called a spreader, or they will use the retractors or whatnot to actually open up this space.
I need you to blunt dissect with your hand, right?
Blunt dissection is an actual term. I think that that's pretty accurate. And it's cool that they're using the vernacular. So blunt dissection basically means spreading apart fascial layers without a particular like sharp edge. Instead of cutting through it, you're just kind of dividing those layers based upon the fascial planes or the planes of tissue that already exist.
Danny, I need you to slow down.
How about we all just get out and walk?
Danny, just give me 20. Now's not the time to argue.
Just as slow as I go.
I need you to slow down, man.
Slow down. I'm with everybody here. Yo.
Crazy shit going on back here.
Come on, dog.
Calm the fuck down.
Yes. It is, man, it's so critical that in high intense moments when we're in the emergency department and there's a lot of things happening, specifically during a resuscitation or some type of a trauma notification, we have to tell everybody and constantly remind them, slow down, shut the hell up. If you are non-essential, you do not need to be talking, because getting the communication correct is literally vital to survival, to this patient potentially like overcoming whatever this injury is. Everybody got to be damn quiet. So I like this, really accurate.
Aorta, yeah, I can feel it.
And I need you to squeeze it now. Squeeze it hard. Just stop the blood.
No.
Trying.
Come on, dog. Hell no.
It's working.
Hell no.
Drop down to 20 miles an hour.
Wait
Give
a
us some
minute.
distance.
No, pause. So she squeezes the aorta. And this is what I guess makes me feel like it's inaccurate as hell. It's because she's applying manual pressure to the aorta and saying that that's allowing the blood pressure to improve. Maybe that's the case, but based upon the vital signs that I'm seeing here, it doesn't look like things are improving. I still see the man's heart rate at 40. So what the hell are we really doing?
Break down our brother right now.
Just squeezing the aorta.
Cam, his blood pressure's dropping. He's about to code.
See, blood pressures are dropping. Like I said, she's not doing nothing. She ain't doing nothing. So now she's holding the spleen. I told you, it's always the spleen.
Wait, look at me if you're just nervous, okay? I said you're just nervous. My wife, she gets nervous all the time. You know what we do?
All right.
We breathe. We do okay.
Right. Pulse 40, blood pressure's dropping. The dude is gonna die. In situations like this, I would consciously think that he needs to be resuscitated a little bit better. They're still trying to stop the bleed. Obviously, he should be getting fluids, products, anything that's available to try to raise that blood pressure and that heart rate while they're trying to stop where the bleed is coming from. So again, quasi-accurate, not 100%. They're trying to give you a little bit of the drama, so we feel it, but I ain't believing it like that, my dog.
I think he's waking up.
There, all the way.
Yeah, he is fully
Ain't
awake.
quite.
Hold him down. I'm in his gut.
Yeah, I think he knows.
Yeah.
Insane.
Stop him, Will.
Yo, no, what? Yo, hold on. My dude woke up in the middle of this joint.
Go to sleep.
Good night. Good night. Shit. Y'all outdone yourselves. The man wakes up in the middle of this joint and is not only conscious, but responsive. And to make him go back down, Yahya hits my man with a straight cross and knocks him out. I'm talking about the most ill anesthesiologist you ever see. One punch, bow, sleep, NyQuil. I ain't mad at that. It's good for the dramatic value, but obviously ain't nobody physically assaulting a patient to make sure that they go out. But sometimes you don't have patients sleep deep enough. And so I understand the need for better sedation. I mean, he said it up front. He said, yo, dude's not sedated, so I get it. Now he done punched this dude. He's, again, not sterile as hell. His hands are in the abdominal cavity, so this dude is definitely dying. He's definitely gonna have sepsis if he survives this procedure in the back of an ambulance that's being chased by cars, police. It just can't get no better than this, y'all.
Pull it out slowly.
Pull the spleen, gentle. I don't want it to burst. Cam, you can do it, gentle. Don't let him die.
It's coming out.
Colin, if this spleen ruptures, he's got 60 seconds.
Accurate
I'm gonna grab it.
as hell, except for the fact
Taking it out.
Except for the fact that she's holding this spleen and it's like, doesn't seem to be connected to anything. She just has it out. That's not accurate. There's a bunch of vasculature attached to it.
Taking it out. I got the bullet. It's coming out. Okay, I've almost got it. I've almost.
So she's using her hand to try to remove a bullet from a spleen in the back of an ambulance that is moving at 20 miles an hour, being chased by the FBI, just in case you forgot where we was at. Yo, good night. That's it. I got to log off, yo. I think this is funny as hell, yo. I mean, not for the dude, obviously, he's dead. But she removes this man's spleen, like blunt dissects down, scavenges for a spleen, pulls it out like it's a Lucky Charm, and then all of a sudden is like going to remove this bullet with precision from the spleen. Of course it's gonna rupture. Of course that thing is gonna explode in your face, Mount Vesuvius, just like we just saw here, yo. I love it, man. I love it. So creative, so inaccurate. She said, oh. Holy shit.
What do I do? I don't know what to do in this situation.
You need to clamp that right now. He's gonna bleed out.
I used all the fucking clamps.
Hey, look at me. Listen. You know what we do? We breathe.
Of course the devices die at this exact moment when they said clamp it.
Clamp on my hair. Grab it.
Wait a minute.
Clip underneath. You gotta grab it
Hell
underneath. Fast.
no. Hell no.
It worked.
All right, I gotta quit right here. a hair clamp doesn't have the sheer spring strength, that tensile strength to actually clamp and close damn near anything. It barely holds hair. And I know this because I wear them sometimes. Shit. But I just think that this is crazy that they were like, oh, what can we think of in this entire EMS vehicle that will act as a clamp? I know a hair clip that's been on somebody's dirty ass head all movie long. But this is what we're gonna use in an emergency to stop the bleed of a spleen that is essentially ruptured. Movies, man, I tell y'all. This is classic. This is amazing. So I gotta stop right here. Ambulance. Holla at me next time for Ambulance 2. Let me be the guy. In actuality, that's not the procedure. You would never get that far. This person would probably code before you even get to the point where you can clamp it. As he said, if the spleen ruptures, you got about 60 seconds. I think that that's pretty accurate. If there's no temporizing measures, this patient is gonna die, especially because this is untrained hands performing a procedure with a lot of vasculature. This dude will go into shock and die, like probably within the next minute, no matter what they try to use to clamp it. And also, if he isn't already dead, like his heart rate got to be damn at the bottom right now. I'm talking about he was already at 40. The pressure support wasn't there. I'm calling bluff. This dude doesn't make it.
Oh, shit.
Did it work?
And of course, he makes it. Right when you think that he's gone, down and out, they say, aha, we got you. All right, y'all, so that was Ambulance. I promise you it is a non-stop thrill ride. I enjoyed the movie. I got a couple of take-home clinical pearls, as we call them. The first one, accuracy level. I would say this is probably around like a 5, maybe 5.6. Things that were extremely accurate, calling out blood pressure, calling out vital signs like blood pressure and heart rate, realizing that after a person has been shot, that they will likely have significant changes in their vital signs. That's accurate to me. And even what she said, you know, the fact that he initially was tachycardic, hypotensive, eventually became bradycardic, meaning that his heart rate reduced, lets me know that this is a serious situation. The man is bleeding out and he needed absolute intervention as soon as possible. That's accurate. Second thing that I think is extremely accurate, realizing that in these intense environments, we have to slow ourselves down, but also demand absolute quiet, peace, focus, whatever we can at that moment so that we can be precise. I thought that was really similar to what it's like when we're in our ED trauma settings or ORs, where you need everybody that's in the room who is non-essential to be quiet or exit the space so that we can focus on the task at hand. The other thing that I thought was really accurate is acknowledging that there's other levels of care and other providers who are more skilled at doing something. So it wasn't like she tried to do it off of her knowledge, even though it says she's some kind of like, you know, resident that essentially stopped residency, went to be an EMT, but she knew that, all right, I have to defer to the next provider, and then that provider deferred to the trauma surgeons. I'm an ER doc. I would never assume that I had the ability to do every single thing that a trauma surgeon can do. That's unrealistic. And so the fact that they had a trauma surgeon, 2 trauma surgeons on the phone during this procedure, good touch, excellent accuracy. Things that I think are absolutely ridiculous. One, nobody's pulling a bullet out of a spleen, and the vasculature that was attached to the spleen just didn't seem to even exist. I mean, they could have done a little bit better on that. Obviously the language, you know, talking about distended abdomen and calling it swollen, or really just saying, hey, you know, I'm going to cut through this with some scissors, not shears. Like a little bit more accuracy on the language would have been a good touch. And then finally, the thing that really trips me out of all of this is recognizing the limitations of an EMT and limitations of this procedure, right? EMTs are incredible. You know, some of the different levels of our first responders or our pre-hospital team are able to do procedures. For example, intubations, that's placing a tube down someone's trachea to help them breathe. That happens before they come to us in many scenarios. And that's because we've got some really good pre-hospital responders that have been trained. I'm talking hours and hours and hours of doing this really specific and critical procedure to take control of the airway. I don't hear people coming in talking about, I took a bullet out or we opened this abdominal cavity. Most of the time it's just apply pressure, wrap it as tightly as we can, speed through every light that we can, and get the patient into a place where they can get adequate care. The scenario is different here because they're in the middle of a car chase and they got criminals on board. Obviously, they're not stopping at a hospital. They ain't throwing nobody out. So she had to do what she had to do to try to save this police officer's life. So I get that, but I think that it's a little gratuitous to assume that you can do a surgical procedure in an environment that's not sterile, poorly controlled, y'all taking contaminants and inserting them into the abdominal cavity every time you do something. Like, all of that to me made it seem like very dramatic, not realistic at all. But it was highly entertaining. I ain't gonna lie, I took so much from seeing Yahya punch my man in the face. Yo, it was so cool to me. With that said, y'all, this has been fun. I'm Dr. Italo Brown. This is Med vs. Movie. Send me the movies that you want me to break down, and I promise you I'll take a look, find some cool scenes, and we'll discuss it, all right? Until the next time, peace.